Hey everybody, my name is Dr. Erica Ellis. I'm a mindfulness-based clinical psychologist, and I'm here today to talk to you about mind, body, brain issues. So I've been thinking a lot these past couple of weeks about Joni Mitchell since she collapsed, because it's shown a light on her battle with Morgellons disease. Now, Morgellons disease is a mysterious, poorly understood skin/psychological disorder. The dermatological component is that people experience rashes, sort of different colored fibers coming out of their skin, and sometimes they have a biting or tingling sensation. On the psychological side, people often also have the belief that they're invaded by some kind of foreign object, by parasites or something like that under the skin. So the disorder is quite controversial and, as I said, mysterious, in part because the symptoms themselves are quite unique, and some would say bizarre, but also because we don't have a medical explanation for them. And this means that they end up in this sort of nebulous world of psychosomatic disorders. And psychosomatic disorders get a pretty bad rap because we don't really understand them. And I'd like to, because I specialize in them, take a couple of minutes here to just bust open some myths about them. So here's how psychosomatic disorders often get diagnosed. You go to your doctor, you say, I have X, Y, and Z symptoms. They check them out, and your doctor says, you seem okay. It's probably anxiety, it's probably stress, go see a shrink. So that's when you come to me. You say, Erica, I went to see a doc, they told me the whole thing's in my head. And here's where the mistranslation happens. Because, in fact, we're not saying that symptoms don't exist. We're just saying that symptoms are not medically driven. They're not driven by something physiological. So what does this mean? Well, if we look back on the previous talk that I did, we can understand a little bit better about how the mind and the brain and the body communicate, and remember that the mind and the body are connected. For every mental and emotional experience we have a physiological correlate to them, whether it's good or bad. So think about it. If you're feeling really happy and joyful, you might feel your breath slow down, you might feel a sense of expansiveness. I can kind of feel it in my own body right now as I'm talking to you guys. On the other hand, if you're feeling anxiety, you might feel your shoulders raise up or tingling in your stomach, butterflies, tension. Okay? Likewise, stress. Stress is a really common one. We know from the research that stress is correlated not only to tensions in our bodies, like tension headaches, but also things like heart disease. So we can see that the mind and the body are connected. So when we bust open this myth about psychosomatic disorders, I'm not saying that the symptoms don't exist and that psychosomatic disorders are a myth. I'm saying the myth is that they are so much more pervasive and ubiquitous than we give credit for. That in fact, everything we do is in part psychosomatic. So it doesn't mean that the symptoms you experienced when you had a panic attack weren't really there. Right? A panic attack is a very common thing that people come to see me for after doctors told them there's no medical reason for it. What we're saying is that your mind might be gaslighting your body a bit. And that if you can get balance over your mind and over your thoughts and regulate your emotions, it'll mitigate the symptoms that you're feeling in your body. All right, thanks for listening. See you next time.